Hello and welcome back to our channel. Today we're discussing an important topic that's been making headlines in recent years, monkeypox. We'll be diving into what it is, its spread, symptoms, how it's diagnosed, and, most importantly, how it's managed. Let's get started. Monkeypox is a rare viral zoonotic disease, which means it can be transmitted from animals to humans. It is caused by the monkeypox virus, a member of the orthopox virus genus, which is closely related to the virus that causes smallpox. Although it shares similarities with smallpox, monkeypox is generally less severe. Monkeypox was first identified in 1958 in laboratory monkeys, hence the name. The first human case was recorded in 1970 in the Democratic Republic of Congo. Since then, the disease has primarily been confined to Central and West Africa, where it is considered endemic. However, in recent years, there have been reports of cases outside of Africa, largely linked to international travel or imported animals. The virus can be transmitted to humans through direct contact with infected animals such as rodents or primates, or through close contact with an infected person. The symptoms of monkeypox can be divided into two periods. The first is the invasion period, which lasts between 0 to 5 days and is characterized by fever, intense headache, lymphadenopathy, swollen lymph nodes, back pain, muscle aches, and severe weakness. The second period is the skin eruption phase. This typically begins within 1 to 3 days after the onset of fever. The rash often starts on the face and then spreads to other parts of the body. It progresses through various stages, starting as macules, then papules, vesicles, pustules, and finally crusts that dry up and fall off. The rash can be quite extensive and may affect the face, palms, soles, and mucous membranes of the mouth and genital area. Diagnosing monkeypox involves a combination of clinical evaluation and laboratory testing. A healthcare provider will consider the patient's symptoms, history of travel to endemic areas, and any potential exposure to infected animals or individuals. For monkeypox, the investigation and management involve a systematic approach to diagnose, treat, and prevent the disease. Here's an overview. Investigation for monkeypox history. Obtain a detailed patient history, including recent travel, contact with animals or infected individuals, and onset of symptoms. Physical examination. Look for characteristic symptoms such as fever, rash, which progresses from macules to pustules, lymphadenopathy, and other signs. Laboratory tests. Polymerase chain reaction, the most reliable method for diagnosing monkeypox. It detects viral DNA from lesion swabs or other bodily fluids. Viral culture, less commonly used, but it can be employed to grow the virus in a lab setting. Serology antibody testing can help determine past infection, though it's less useful in acute diagnosis. Electron microscopy can be used to identify the virus in samples, though not routinely performed due to the availability of PCR. Supportive care symptom management. Treat symptoms such as fever, headache, and pain with antipyretics, analgesics, and adequate hydration. Skin care. Proper hygiene and topical treatments for the rash to prevent secondary bacterial infections. Antiviral treatment for monkeypox includes several options. Tecovirimet is one such antiviral that has been approved for the treatment of monkeypox in some regions. It targets the viral envelope protein, inhibiting the virus's ability to spread. In more severe cases or for patients who are immunocompromised, antivirals like cidofovir or brincidofovir may be used. These treatments aim to help manage the infection and prevent complications. Infection control. Infected individuals should be isolated to prevent the spread of the virus. Healthcare workers should use appropriate personal protective equipment, including gloves, gowns, and N95 masks, when caring for patients. The smallpox vaccine, such as Jynneos or Imvamune, has been shown to provide protection against monkeypox and can be used for post-exposure prophylaxis. Public health measures. Identify and monitor contacts of confirmed cases to prevent further transmission. Close contacts may need to be quarantined and monitored for symptoms. In areas with outbreaks, vaccination campaigns may be conducted to control the spread. Monitoring and follow-up. Regular monitoring of the patient's condition is essential, especially if complications arise. Follow-up after recovery is crucial to ensure complete resolution of symptoms and to manage any long-term effects. Effective management of monkeypox also involves educating the public about the disease, its transmission, and preventive measures. If you found this information helpful, give us a thumbs up, subscribe for more health-related content. Thank you for joining us.